And today it's a few weeks more into this coronavirus epidemic that we're seeing, and things have changed. This is not going to be a matter of a few weeks. This is going to be months to years to handle this. This is going to be about lifestyle changes in our generation. This is going to be the most important thing we have seen in our generation. And I have lots of questions I keep getting on a daily basis from providers who see me at the hospital, from nurses, and there's a lot of fear. But for coronavirus, we're not quite sure, but most people, experts, believe that we're not going to have lifelong immunity. What does that mean? This means that this virus can be here for 6 weeks, it could be here for 6 months, it could be here for 6 years. And even though as we handle these infections and as we are exposed and we become infected, we're not quite sure, are we going to have immunity for how long? Are we going to be reinfected again? And most of us believe that's a yes, just like the influenza, just like rhinovirus, just like other coronavirus infections. We do believe that can happen. So again, that comes up to the interesting question, have we gotten rid of the influenza with the influenza vaccine? And that answer is no, we don't have a universal influenza vaccine. There will be multiple strategies of working and developing vaccines. And it's not clear this time if we're going to have a vaccine and how effective that vaccine is going to be. Is it going to be 50% effective? Is it going to be 75% effective? 100%? We don't know that answer. As optimistic as we are that there'll be a vaccine within a year, we're not sure how it's going to work and how well it's going to work. So you're exposed today, for example, and it will take about 5 days on average to develop for incubation time. Most symptoms are by day 10, and that's why we encourage you quarantine for up to 14 days. But symptoms can develop as early as 2 days and last as long as even 14 days. We're even recognizing that if there could be viral shedding much longer. Viral shedding can probably occur up to in the 35, 37 days, and that's a concern. So the virus can actually live in an aerosolized form in patients who have been nebulized. It can live in the air up to 3 hours, and that's quite concerning. And that's one of the reasons we recommend an N95 mask for healthcare workers who are very close to patients who are involved in care of those patients. And it raises the question that we've gotten throughout, questions about airborne. Is this virus airborne? And it's debatable. I mean, just by looking at some of the data, it's airborne. When you look at how quickly this virus is spread, and many of healthcare workers are saying, well, if it's just droplet spread, how come so many people become infected so quickly? Is there more to this story that we don't know? And I'll leave that question hanging there because I still don't know that answer yet. And I'm very optimistic that this temperature change is going to impact the virus. There's viral models which have shown, depending on temperatures and the latitude and location of where we live, that this will affect the replication of the virus. So the next week will be interesting to see what our numbers look like in Florida. Yes, we just had a case recently who recently traveled and was told not to travel, was diagnosed and identified as to self-quarantine and still traveled. So that's a big issue. What is very concerning for me at the present time is still the movement of people within the country. Flights are coming into West Palm Beach from LA, from New York City, and there are flights with patients who are positive, clearly defined positive and are traveling. And this is very concerning that we still haven't addressed that issue of internal flights. When we are having almost so many states around with cases, why are we not addressing that question? So we have stopped international flights, but because we thought that this is where we'll get infections, but here we are in this country right now, multiple states with large amount of patients, and as we know, the destination for a lot of New Yorkers is Florida. So why haven't we addressed flights coming in from New York to Florida? Why haven't we addressed these questions? And these are what I've been asked by multiple healthcare providers as well as nurses and people in the community.
You're seeing cases from people doing this?
Yes, we just had a case recently who recently traveled and was told not to travel, was diagnosed and identified as to self-quarantine and still traveled. So that's a big issue.